Hi, I'm Kelly Lemke with Maryville University, and I'm a family nurse practitioner student. This is my patient, Kaylin. I've asked her to empty her bladder to get into something comfortable for the exam. We've checked her vital signs, her height, her weight, and we've checked her vision, her near vision, and distance vision using the Snellen chart and the Rosenbaum. Okay, first thing I will do is start with inspection, and I will inspect her face and her head for any abnormalities, anything that's asymmetrical, any masses, checking her scalp, again looking for any masses, checking hair distribution and making sure her hair doesn't come out easily, there's no alopecia, it doesn't break off, her eyebrow distribution is normal, checking her face, her facial bones, check her sinuses too, and her TMJ, how you open and close. No clicking or popping is noted. Okay, I will go to her ears and again looking for symmetry. They're symmetrical. Palpating for any abnormalities, any tenderness. Okay, all right, we'll do the Weber test. Let me know if you can hear this in both ears.
Yes.
Okay, we'll now do the Ren test. Tell me when you cannot hear this anymore.
Okay.
And again, tell me when you can't hear it.
Okay.
And air conduction should be twice as much as bone conduction.
Okay. Okay.
Okay. We'll now do the whisper test, and I'll ask you to cover your right ear, and I'll whisper a word. Apple. Okay. I'll have you cover your left ear.
Orange.
Okay. Hearing is intact. Now look at her temporal membrane, looking for the pearly gray. Okay. And her ear canals are clear, and the pearly gray is seen. Okay, now looking at her nose, it's symmetrical. Looking at her septum, feeling, palpating. Okay, I'll have you occlude one side. Okay, checking for patency. Do the other side. Okay. Looking at her turbinates, looking for pink, moist, and they are, and no swelling. Okay, now look at her eyes. Looking at the conjunctiva and the sclera. Pink, moist. Okay, now check her reflexes and looking at the accommodation of her pupils. Direct, consensual, direct, consensual. Okay, and that's present. All right. I'll have you cover this eye, uncover, cover, okay, cover, and cover, and uncover. Okay. All right. And you follow the tip of my pen. I'm looking for any abnormal movement. Okay, and then sing. Alright, I'll have you cover your eye and tell me when you can see my fingers.
There.
Okay. Do the same thing, checking for peripheral
There.
vision.
There.
Okay. Alright. Now moving to the lips and the mouth. Looking for any cracks or fissures. And I don't see any. Okay. Alright, open your mouth. Again, the hard palate and the soft palate and the tonsils say ah.
Ah.
Teeth look good. No dental caries noted. Lift your tongue and look at the floor. Okay, no masses, no ulcerations noted. Okay. Let's check your gag reflex. Okay. Alright. Alright. Moving to the neck. Looking for any, before I move to the neck, I'll have you clench your teeth. Checking for muscle tone. Okay. Puff out your cheeks. Smile. Stick out your tongue. Side to side. Okay. Close your eyes. Okay. Wrinkle your forehead. Okay. Alright, now we'll look at the neck. And it appears to be midline. And I'll check the trachea. Checking to make sure it's midline. And then I'll check the thyroid. Palpating the thyroid to one side as she swallows. And it moves. Okay. And then I'll palpate the carotids. Again, one at a time. Okay. And then I will auscultate using the bell of my stethoscope. I'll have you hold your breath. Okay, breathe. And take a deep breath and hold. Okay, breathe. One more time, take a deep breath and hold. Deep breath and hold. Okay. No bruise or any swishing noted. Okay. Move to the anterior. No, before I move to the anterior chest, I'm going to check the upper extremities. And I'm going to look for any asymmetry. I'm going to check the skin temperature. I'm going to look at the fingernails. Check for capillary refill. It's brisk. I'm going to check the pulses. Okay. Brachial. Okay. I'm going to have you turn your head from side to side. Okay. Touch your chin to your chest. Look up. Do the same thing against my hand now. Okay. 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 Shrug your shoulders. And against. Okay. All right. I'm going to now check the lymph nodes, the preauricular, postauricular, tonsillar, submandibular, mandibular, submental, the occipital, postcervical, superficial, and deep cervical, and supraclavicular. And I'll have you raise your arm straight out to the side, and we'll check the axillary. Okay. All right. Now I'll move to the posterior chest. I'll inspect the skin, looking at, checking the temperature, and looking for any abnormalities. None are seen. I'm going to check for expansion. Okay, take a deep breath. And it is symmetrical. Okay. All right, I'm going to have you say 99.
99,
Checking for
99,
tactile affinities.
99, 99, 99, 99, 99, 99.
Okay. All right, I will now percuss. Okay, now I'm going to check for CVA tenderness. Okay. Now I'm going to check diaphragmatic excursion. I'm going to have you take a deep breath and hold it. Okay. Now I'm going to have you take a deep breath. I would put a mark here. I'm going to have you take a deep breath and let it out and hold. And I would mark that and measure it, and it should be 3 to 5 centimeters. And I would do that on both sides. Okay? I'll now auscultate for breath sounds. Having you take a deep breath in and out. Okay, I'll listen on the lateral side. Okay. Alright. I'm going to turn to the front and look at the anterior chest. Again, looking for symmetry, any pulses, heaves, anything abnormal. And I will have her do, say 99.
99, 99,
Checking tactile affinities.
99, 99, 99, 99.
Okay. And then I will percuss. And you raise your arm. Okay. Alright, now I'll listen for breath sounds. Good. Deep breaths in and out. Raise your arm up. Deep breath. And again. Okay. Alright, now I'm going to feel for any pulses. Feeling for the apical pulse. Okay. Now auscultate heart sounds, starting with the aortic. pulmonic, Erb's point, tricuspid, and mitral. Okay. And there's no rubs, no clicks, no abnormal sounds. Okay, go ahead and have you lay down. Alright, I'm going to inspect the abdomen, looking for any abnormal pulsations, anything abnormal. Alright, seeing none, I'm going to auscultate for vowel sounds. And if I don't hear anything, I would stay in that quadrant for 3 to 5 minutes. Okay, I'll auscultate the aorta, the iliac and renal. Listening for any bruise, and now the femoral. And now percuss. Okay. Alright. Now percuss the liver. Alright, and now come up here and go down. Okay, and then I'll measure that. And it should be 3 to 7 centimeters. And checking for splenic order. Okay. Alright. Now palpate. Maybe take a deep breath and let out. Okay. And the same thing again. Checking for splenic border. Okay. Now palpation. And then deep palpation. Any tenderness? Okay. Okay. Alright, we'll check her aorta. Any abnormal pulsations. Okay. Go ahead and have you sit up. Alright, I'll now inspect her lower extremities, but before I do that, I'm going to check sensation on her face, and I'll have you close your eyes and tell me if you feel this the same on your forehead.
Yes.
And your cheek.
Yes.
And your chin.
Yes.
Okay. All right. I'm going to look at her legs. I'm looking for any edema, any abnormal hair distribution. I'm looking and feeling for skin temperature, checking edema. And then I'm going to check the popliteal, pulse, dorsal, pedal. Those are 2+. Okay. Muscle tone is symmetrical. There's no atrophy noted. All right. Hold your arms straight out. Push against me. Again. Okay. Now put your arms straight out in front of me. Push against me. Okay. Pull. Okay. And push. Okay. And muscle strength is good. I'm going to check reflexes. And check the brachial. And I'm just looking for slight movement in the brachial muscle. Okay. All right. I'm going to check her knee reflex. Okay. And I'm going to hold your foot, just relax, and check the Achilles tendon reflex. Okay. And those are intact. Okay. All right. I'm going to have you stand up. I'm going to check your back. Have you bend over? Step forward just a minute. Okay. Now, have you bend over and we'll check your thoracic and lumbar areas. Make sure the curvature is correct. Okay. Now, I have you walk across the room and come back to me. And her gait is normal. Okay. Okay, and this will conclude my head to toe physical examination.